Hello everyone, my name is Robin Aurora and today I am going to talk about epilepsy. In this video we will discuss about what is epilepsy, the different types of epilepsy, the causes of epilepsy and the first aid of epilepsy. If you find my information worthful or useful, please text me on 0421489043. Thank you very much. Now we will start with what is epilepsy. Epilepsy is a general term used for a group of disorder that cause disturbance in electrical signaling in the brain which can cause seizures. Now we are going to discuss about different type of seizures, followed by the video which has been downloaded from the YouTube to give you further information. So what are the types of seizures? There are absence, myoclonic, clonic, tonic, tonic-clonic and atonic seizure. Now we will see the video to understand each type of seizure.
The word seizure is a general term used to describe the medical condition in which too many brain cells become excited simultaneously.
There are so many kinds of seizures that neurologists are still updating how to classify them. Usually they classify seizures into two main types: partial seizures and primarily generalized seizures. The difference between these types is in how they begin. Primarily generalized seizures begin with a widespread electrical discharge that involves both sides of the brain at once. On the other hand, partial seizures begin with an electrical discharge in one limited area of the brain. All generalized seizures begin with synchronous electrical activity throughout the brain, accompanied by sudden generalized movements or loss of consciousness. However, there are still many different types of generalized seizures. A tonic-clonic seizure, once called a grand mal, is what most people think of when they hear the word seizure. When someone experiences a tonic-clonic seizure, first they stiffen and lose consciousness, which is the tonic phase. Then they begin jerking, and this lasts for several minutes, called the clonic phase. Sometimes seizures don't have a tonic stiffening and a clonic jerking sequence, but are just tonic seizures or clonic seizures. Other types of generalized seizures include absence seizures, when the sufferer disconnects from the world for a few seconds, and myoclonic seizures, which cause jerking, but just for a second or two. Partial seizures, which begin in a single part of the brain, are further described by two important additional criteria. The first is whether awareness, memory, and consciousness are preserved during the seizure. If they all are preserved, then a seizure is called simple partial. However, if any are impaired, then the seizure is called complex partial. The impact of a partial seizure depends on where in the brain it originates and how it spreads. Partial seizures sometimes have an aura, which is a warning that bigger seizures may follow. An aura usually occurs seconds to minutes before a seizure, but some patients can have periods of warning lasting a day or longer. There are many different ways in which people experience an aura. The start of a seizure in one of the temporal lobes can produce unusual feelings, abnormal sensations, or forced thinking. The onset of a complex partial seizure may be heralded by déjà vu, a familiar feeling, or jamais vu, an unfamiliar feeling. Some patients have auras of sounds, tastes, distorted vision, racing thoughts, or smells, like burning rubber. Physical sensations that can occur as auras include dizziness, headache, lightheadedness, and numbness. An upset stomach is a particularly common physical symptom. Auras can include a sense of tingling, rising up the body, or other strange feelings that are difficult to describe. Distorted emotions like fear or panic can also be a seizure warning. However, some complex partial seizures occur without any remembered warning. Understanding the different types of seizures can be helpful, but many people want more detailed information. The next 2 videos in this series provide an in-depth look at the effect of partial seizures on different parts of the brain and the different types of generalized seizures. If you or anyone you know may have seizures, please make sure that they see a physician.
The movies in this series can be viewed in any order. If you wish to watch these clips in their original sequence, the next video is Understanding Partial Seizures.
Now, in the next video, we will see the causes of epilepsy.
Epilepsy affects nearly 3 million Americans, but who is really at risk?
Epilepsy can develop in any person at any age. Almost 1% of people will develop epilepsy during their lifetime. That's 60 million people worldwide. In other words, out of a 60,000 person stadium, about 500 will have epilepsy. New cases of epilepsy are most common among children, especially during their first year. The rate of new cases gradually declines until about age 10 and then becomes stable. After age 60, the rate starts to increase again. Many famous people in history had or may have had epilepsy, including world leaders like Julius Caesar, writers like Lewis Carroll, who wrote Alice in Wonderland, artists like Vincent van Gogh, and athletes like Chanda Gunn, goaltender for the U.S. Olympic hockey team. The causes of epilepsy can be divided into 2 groups: brain injuries and chemical imbalances in the brain. Anything that injures the brain can lead to seizures. But in over half the cases, no cause can be identified. The type of injury that can lead to a seizure is age-dependent. Seizures in children often are caused by birth traumas, infections such as meningitis, congenital abnormalities, or high fevers. Seizures in the middle years commonly are caused by head injuries, infections, alcohol, stimulant drugs, or medication side effects. In the elderly, brain tumors and strokes cause a higher proportion of seizures. Not all seizures result from a structural problem in the brain. Chemical imbalances also can cause seizures. Common chemical imbalances that can produce seizures include drugs like alcohol, cocaine, and others, low blood sugar, low oxygen, low blood sodium, or low blood calcium. Kidney failure or liver failure can also produce seizures. Doctors will evaluate you for these imbalances by taking a careful history and doing blood tests. Although these and injuries can explain many cases of epilepsy, often the cause of epilepsy remains idiopathic, which is the medical term for unknown. About half the time, no cause for a seizure can be identified. Fortunately, we do not need to know the cause to treat the seizures. Scientists increasingly recognize the importance of genetic factors in the origin of epilepsy. Genetics or heredity are most relevant to generalized seizures, including absence, generalized tonic-clonic, and myoclonic seizures. Defects in genes don't lead directly to epilepsy, but they can alter the excitability of the brain in a way that predisposes it to seizures. Typically, epilepsy develops because of multiple gene abnormalities or a gene abnormality in concert with an environmental trigger. Parents with epilepsy wonder whether their children will have epilepsy. In most cases they won't, but they do have a higher risk than others. If the mother has a generalized type of epilepsy, the child's chance of having epilepsy may be as high as 5 to 20%. But if a parent has epilepsy due to a brain injury, the child's chance of having epilepsy is only about 5%. If you or someone close to you is suffering from seizures, please see a physician.
The movie